Alright, so I'm going to do the prone leg length indicator. Take my patient's legs. I'm going to pull your ankles apart and push against my hands, please. And then I put my thumbs underneath the medial malleolus. And her right is her short leg because my thumb is superior to the other.
Alright, and
Okay, so we're going to first check for atlas dural subluxation. We're going to put tension in her ankles, and I'm going to have my patient turn to the right and to the left. And I am feeling for a bump in both ankles as she turns her head. If I do not feel one, that would indicate that there is a lesion on that side. I first traction her long leg side while her head is in neutral, and I hold it for 10 seconds. I then have my patient move to the left and right while I traction both, and that'll remove, while I traction her short leg, and that'll remove any adhesions that are there. And then I have her turn her head to the short leg side while I traction both. And lastly, I will check to see if the adhesions are going. And I'll do it for 3 sets of 10 seconds each. So the confirmatory for category 1 is the heel tension test. Earlier we did find that her right leg was the short leg. So to confirm, we're going to check the tension on both. I can either check one-handed or two-handed. Do one side, then the other. This one feels tighter. The Achilles tendon is also thicker, which confirms that this is the right leg and she is a category 1.
hold on, I'll tap you on the shoulder.
For the trap fiber analysis, we're going to check 7 points in the trap. Number 1 is going to be here in this hollow. Number 7 will be just lateral to the TVP. And number 4 will be, this is 7, this is 4 in the middle. So we're going to do this one, 2, 3, 4, 5, 6, and 7. We'll ask the patient which is the most tender. We'll do the same on the other side, and then we're going to compare which is the most tender spot from right to left. And then once we've established which spot is tender, we'll refer to the chart, the trap fiber analysis chart, and that will correspond to points on the spine. We'll then check each of those spots on the spine, finding the most tender, and when we find that one, we'll adjust it at the SP in a superior direction with a knife edge contact. All right, to name the major crest sign, we're going to first do the Thomas, and we're going to start here 3 inches out, and we're going to press in and to elicit pain. And then we'll take our 4 fingers on either side of these muscles. We'll bring it in, and the thicker side, which is her right, will be the major side. To name the major and minor dollar signs, we're going to find patient's PSIS. Right here, we're going to go out 2 inches and then down 3, and then we'll check both to see which one is mushier, and that'll be your minor sign. So on this patient, it is the right. So Krista's is a right short leg. I will be blocking her. I would first place the stability pad underneath her so that it is placed 4 inches above her iliac crest, so it would be right about here. Because her right leg is short, do you have any issues with either of your knees?
No.
Okay. I'll place the first block here. I'm going to use her leg to passively lift her hip, and I'm going to place it right under the greater trochanter. And on the other side, placing it downward, I'm going to place this one under her ASIS. And then I will make sure that my patient is balanced. And the purpose of this one's a little too high, is to bring balance to the body and also to strengthen her short leg. Okay. So my patients can only be on the block for 10 minutes. If I see at about 6 minutes she's still not progressing, I'm going to see if I can goad. For the crest sign, I will come up here, I will stabilize her sacrum, and I will goad the muscles on the minor side. And for the dollar sign, I will stabilize her sacrum, and I will go here, and all the time checking either side for to see if the tonicity is equalizing on both sides. Okay, that's it. Patient, I've already determined whether the biggest discrepancy is with the dollar or the crest sign, and that's the sign that's the one that I would adjust for or set. First, I'll demonstrate how to set for a crest sign. For a crest sign, the 3 rules are to always adjust the major side first, and number 2 is never adjust over the blocks, and 3, never remove a block to adjust. So for her, we're going to say that her left side is her major side. So we would be adjusting. We would find her issue tube. I'm going to palpate you if that's okay. Here, and then it's going to be just a thrust right there to set that issue tube. Then we walk around clockwise to the patient's other side. And for this, it'll be a roll right off her iliac crest, a knife edge contact, and then a simple roll off one thrust. For the dollar sign, this time she has a right major. We are going to, so for the dollar sign, we're going to do a PSIS torque. We're going to torque towards the midline. It's going to be here and this way. And then and then the glute scoop, I'm going to contact your glutes if that's okay. We're going to come together like this with your hands, and we're going to scoop it up like that. For the sacral base analysis, we're going to place, I'm going to lift your shirt up a bit. We're going to place our thumb here on the base of the L5 spinous cord with our fingers pointing towards the head. We're going to have our patient, would you cough please? And we're going to notice where our thumb goes. If our thumb goes up towards the ceiling, that's a positive. If it goes, if it goes this towards the head, that is a negative. And if it goes off to the right, to an oblique angle, that is a neutral. For a positive, we're going to move the blocks so that they are, lift this side, so that it forms a smiley face. And for a negative, it would be this way, and for a neutral, out that way. For the patient's comfort, I'm going to remove this for now. But for a positive, we're going to breathe in with the patient, put our hand on the sacral base, and as the patient breathes in, put pressure and then relax, pressure and then relax. For a negative, we'll do the other side so that it's on expiration with expiration, we'll put pressure here and then relax, exhale and relax. And then for a neutral, we're actually going to teeter-totter the sacrum and breathe in with the patient and out with the patient for 3 respirations. We've just done the sacral rock, and during that adjusting the sacrum, I was watching his spine looking for any discoloration, whether blanching or a redness. That would indicate a block of the CSF fluid. I would then palpate and ask my patient and work with him to find the most tender spot. I will locate the most tender spot, and I will coordinate with the chart to find the corresponding spot in his cervicals, and I am palpating here for dampness while I pump, or for wetness at the spot, and that will indicate that I can move on to adjust it. And if it were this spot, with inhalation, with a positive reading, I would adjust with exhalation, with a negative reading with inhalation, and with neutral either, and it would just be a quick, sharp, superior thrust.